Welcome to this deep dive. Today, we're focusing on a sector that is, well, vital to every single one of us, healthcare.
It really is.
We all rely on hospitals, on clinics for our most critical needs, but what's holding up that massive infrastructure, the people doing that life-saving work?
Well, the answer is often the really complex, high-stakes function of human resources.
That's right. When you look at the sources, the role of HR in healthcare is just amplified compared to almost any other sector.
Absolutely. It impacts everything from the quality of the staff you hire to compliance and then ultimately, patient safety and satisfaction.
So our mission today is to unpack the unique and frankly immense struggles this field faces.
And then we'll pinpoint how strategic changes, specifically leveraging cutting-edge automation and analytics, are providing some real scalable solutions.
And it's so crucial to establish this right up front. HR professionals in healthcare, they aren't just pushing paper.
Not at all. They're an essential link in the chain.
They're vital for recruiting top talent in this hyper-competitive market, for managing these incredibly complex 204/7 shift schedules, specialized payroll.
And not to mention, ensuring regulatory and legal compliance, which is a minefield in itself. All of that, as you said, to drive better outcomes for patients. The complexity is just immense.
So they're fighting this war on multiple fronts: finance, staffing, retention, all under the constant pressure of patient care.
Precisely. And recognizing the strategic value of that HR function, moving it from just a cost center to a real strategic partner, that's the first step.
Okay, let's unpack this then, starting with the specific struggles. We've identified what we're calling the triple threat.
A good name for it.
Three major interconnected challenges that make navigating this industry so incredibly complex.
The first struggle is really this fundamental tension, this balancing act between costs and what is now a full-blown staffing crisis.
So money and people.
Exactly. HR has to balance these enormous organizational and contract staffing expenses with wage demands that are just constantly rising.
And this is all made worse by a serious shortage of qualified candidates.
An acute shortage across almost every specialty.
And the sources really dig into why that shortage is so bad, right? It creates this financial squeeze because medical professionals, especially experienced nurses.
Right. They're opting for those very lucrative, high-paying travel agency positions over a traditional hospital job.
And that's not just a small inconvenience for an HR department trying to staff a facility consistently, affordably. That's a huge challenge.
It's a massive financial and retention problem. If you have to rely on agency staff, your labor costs just explode.
And that explosion in cost, I imagine, ties directly into the second threat.
It flows right into it. Career burnout.
Of course.
The whole nature of the industry is demanding. The long hours, the high-stakes decisions, and that, coupled with all this uncertainty, it just takes a severe toll on everyone.
And this is where it gets really interesting, because the sources show that the impact of the COVID-19 pandemic isn't over. It's not a past event.
No, it's an active trauma that is still exacerbating the burnout crisis.
It led to huge employment drops, reduced hours, and just immense stress and moral injury for the people who stayed.
And that trauma doesn't just go away when the headlines change. It lingers.
So what's HR's role in that?
Their role has to pivot. They have to be hyper-vigilant about the long-term psychological and physical impacts of that trauma. A pizza party is not going to fix this.
Right.
They need to deploy real flexibility, comprehensive benefits, and create an environment that actually encourages professionals to stay in the field.
And if they don't intervene?
If they fail, the burnout cycle just keeps chewing through the workforce. It's that simple.
Which brings us to the third struggle, which is a fascinating one, this organizational friction.
Yes, the resistance from healthcare professionals.
Yeah, tell us about that.
The sources are really clear. A medical professional's primary, all-consuming focus is patient care, as it should be.
So anything that takes them away from the bedside
Can be seen as a distraction. They might struggle, or even just refuse, to see the importance of HR initiatives, admin procedures, or that mandatory compliance training.
I can see that. It creates a real tangible conflict.
A daily one. Imagine HR mandates 4 hours of complex online training during a week when the ICU is already critically short-staffed.
The clinician is going to see that as a dangerous distraction from life-saving work.
And any trust HR has built up, it just evaporates in that moment.
So HR is stuck in the middle, trying to bridge that gap.
Exactly. They have to convince clinicians that the business side of things, patient satisfaction scores, following safety procedures to prevent lawsuits, is just as crucial for the organization's stability.
Which, in turn, allows the clinician to keep doing their job.
Right. So knowing the problems, costs, burnout, resistance, that's the first step. But the sources also lay out these foundational practices that rely on people, on empathy, not just on software.
It's about building trust first. So how do you build that trust when you're the department people associate with mandatory online training?
It really comes down to consistency. The first actionable step is just delivering on your promises.
As simple as that.
If HR says they'll fix a payroll error or a scheduling conflict, they have to do it immediately and reliably. That consistency is then supported by implementing what's called strategic workforce planning, or SWP.
And SWP is just about aligning what HR is doing with the bigger organizational goals, right?
Precisely. Like, say, reducing the reliance on that expensive contract labor we talked about.
I see. So if HR can use SWP to show, hey, our initiatives successfully staff the hospital with great permanent employees, then the clinicians see the direct benefit.
They see the value, and they become less resistant. It's a direct link.
This strategy also seems to caution HR against becoming too isolated.
Yes, it's very easy for an HR division to become a silo, to see the rest of the organization as just, abstract internal clients.
So the key is to understand both internal and external clients. Let's start with external. Why does an HR benefits coordinator need to care about the local community's demographics?
Because it increases their sector knowledge. They need to understand the patients and the communities the organization serves. That helps them tailor recruitment, tailor benefits packages to what the local labor pool actually needs and wants.
Okay, and internally, how do they get that deep knowledge?
Internally, it's about using a tool called Organizational Network Analysis, or ONA.
ONA. Now that sounds like a serious piece of tech. It's not just a fancy org chart, is it?
Not at all. ONA maps the actual flow of communication and influence, not the one that's on paper.
So in a chaotic hospital environment, what does that unlock?
It gives you data-driven insights. It shows you how different departments really interact. For example, it can map the handoff points between the emergency department and the ICU.
And it can show you where the friction is.
Exactly. If ONA shows that a few key people are overloaded, that they're communication bottlenecks, HR can see why stress is building up and they can intervene proactively.
That makes so much sense. The data from ONA tells HR exactly where the administrative friction is worst, the confusing emails, the clunky shift swap process.
And that intelligence then dictates which processes you need to automate first.
Which is the perfect pivot. While the human strategy is key, integrating automation is what addresses those huge time drains. So what does this look like in daily operations?
The sources are unanimous on this. Automating core HR functions is now essential for survival. It's not a nice to have.
So the focus shifts from just processing transactions to saving time.
Right. Automating those key procedures gives HR the bandwidth to actually interact with workers, to solve those problems ONA identified, and to focus on improving the workplace culture.
And the technology here has to be really specialized. We're talking about things like automated new hire onboarding. The sources said that can cut onboarding time by 60%.
That 60% figure is massive, and it's achievable because healthcare onboarding is so complex.
It's not simple.
You have deep credentialing checks, license verifications, background checks. Automating all that along with offboarding, PTO management, digital forms, it removes friction that used to take weeks.
Let's talk about the front end of that process for a second recruitment. With the staffing crisis, hospitals are just constantly recruiting.
All the time. And that's where an advanced tool like a Recruit ATS, an applicant tracking system, is essential.
And in healthcare, that's doing more than just matching keywords on a resume.
Oh, much more. It's handling the regulatory complexity up front. It's verifying a candidate's specific certifications against the job requirements, like trauma certification, for example. It quickly filters a huge pool of applicants. So HR only spends time on people who are actually qualified and compliant.
So it's about speed and compliance, which hits both the cost and the staffing crisis. The sources also mentioned a strong connection to training.
Yes, HR can use these same online platforms not just for compliance, but to enrich training for nurses and medical students. It streamlines knowledge sharing and ensures everyone has access to the most up-to-date information.
And beyond just efficiency, the tech has to drive engagement. That's the real antidote to burnout.
This is where things like recognition and rewards platforms come in. Tools like Workmates, for example, that are used to motivate employees with meaningful, timely recognition.
And there was a surprising fact in the sources about this.
A really surprising one. Recognition drives 12 times higher engagement.
12 times?
It's a huge, inexpensive multiplier for morale. When a nurse gets recognized for handling a tough case, That immediate validation really helps combat the emotional drain of the job.
Which also ties into communication. Keeping a huge dispersed staff on the same page is hard.
It is, which is why you need a central employee communication platform. For company announcements, with tracked acknowledgments, which is key for compliance, and customizable channels for specific teams, like the night shift surgical crew.
And critically for crisis communication, all accessible on mobile.
And finally, technology is our best tool for getting ahead of burnout. The strategy has to be promoting real work-life balance by monitoring staff workloads closely,
How does that work?
by implementing continuous performance management, using data from scheduling tools to spot the early signs of fatigue or overload.
So this isn't about micromanaging, it's about proactive intervention.
Exactly. The system flags that a clinician has worked 6 straight shifts over 10 hours, and HR gets an alert to step in and mandate some time off.
So you address the issue before it escalates into full burnout, or worse, a patient safety error.
That's the goal. All these tools, the mobile app, the shift planner, the time clock, they handle the routine administrative burden, and that frees up HR to focus on the human part of human resources.
Addressing stress, building trust, and implementing that strategic planning that actually works.
That's it.
We've covered a massive amount of ground today. The critical balance of rising costs versus burnout, the challenge of getting clinician buy-in, and the specific tech tools from Recruit ATS to analytics that unlock those hidden friction points.
I think the essential takeaway is that effective human resource management, it isn't optional. It's absolutely crucial for providing high-quality healthcare,
It's a core function.
a core function. And reinventing HR in this sector requires policies that leverage strategic workforce planning and automation. It's really the only way to improve efficiency, boost satisfaction, and ultimately enhance patient care.
As you integrate this deep dive, consider the inherent tension we've discussed. If a healthcare professional's focus must always be 100% on patient care because lives are literally on the line, how can HR successfully build that trust and show the necessity of business compliance and their own initiatives without distracting from that life-saving mission? That's something for you to mull over as you see how these complex systems interact in the real world.